Hello, and welcome to today's mHealth News and Healthcare IT News webinar, our Smartphones Smart for Healthcare, sponsored by Spectralink. As smartphones continue to become mainstream in our personal lives, there's a temptation to use them at work as well. After all, if a smartphone works at home, why can't it just as easily work at work? During this webinar, you'll learn the dangers of using smartphones in healthcare and how to combine the best features of smartphones with reliability needed for work. Our speaker today will be Mike Lancelotti, Vice President of Marketing and Product Management at Spectralink. Mike manages the product roadmap and lifecycle for Spectralink's Wi-Fi and DECT in-building communications product line, as well as the go-to-market strategy. Mike has an MBA with concentrations in marketing and finance from UCLA's Anderson School of Management. And now I'd like to hand it off to Mike to begin our presentation.
Thank you, Eric. I'm going to start reviewing the agenda for today's presentation. The first thing that I'll talk about is the issues of smartphones and nurses. And as Eric summarized at the beginning of this, the question that we get a lot is, if my personal consumer smartphone works so well at home and in my personal life, how come I can't use it at work? Then we're going to talk about combining the best features of consumer smartphones with a real workplace productivity tool. And then I'll talk about why Pivot by Spectralink can help nurses and other people in healthcare organizations work smart. Also, as was mentioned, we'll have about 15 minutes for questions at the end of the presentation. So please go ahead and submit your questions while I'm talking, and then we'll have a chance to address them at the end. So let's start with this tug of war that's happening today between the nursing staff and hospital IT. And this is becoming more and more prevalent as we're seeing nurses say, I need a smartphone to do my job. When I'm in a clinical setting, I need a smartphone in order to do the things I need to do with my patients, in order to be more productive, more efficient, and to provide the care I need to for my patients. What we're generally seeing from hospital IT is no. And it's a very loud no. In fact, we rarely see hospital IT allowing nurses to use smartphones in their jobs. As we all know, nurses often do what they need to do. So what we're seeing a lot is nurses saying, well, IT, if you're saying no, I'm going to do it anyway. And finally, what we see happening is hospital IT turning the other way and finally saying, I'll pretend I didn't hear that. I will pretend I don't see the nurses using their personal smartphones, yet they know it's happening. We all know it's happening very often out there with nursing staff. This is an unacceptable situation that puts everybody at risk. The hospital is at risk, the caregiver is at risk, and ultimately the patient is at risk. And we're going to talk about what some of these risks are and why this is happening, why the nurses are using their personal smartphones, what they're doing with them. But also we're going to equally talk about the concerns that hospital IT has. Hospital IT has some very legitimate concerns about the use of consumer smartphones as the nurses are working in a clinical environment. So that's really what this presentation is about today. And I've made this introduction a little bit lighthearted, but this is actually something that's very serious, and it's happening all over the country. I'm going to start with some data here, and it's based on a study that was done by a company called Spyglass Consulting Group. It was an independent research that was done very recently. It's just been published in March. And they went out to about 100 hospitals across the U.S., and they asked this question exactly this way. Are your staff nurses using their personal smartphones as they do their job to support clinical communication? And I knew it was happening, but I have to admit I was surprised by the extent of this. Over 2/3 of the hospitals around the U.S. know that their staff nurses are using smartphones. It's really a shocking figure. These are their personal smartphones as they're doing their job in a clinical setting. So nurses are saying something very clearly here. They are saying that they need smartphones to do their jobs. But think of the risks involved. I think we all know the risks involved with HIPAA and patient privacy. I know as a patient, I don't want my personal information on my nurse's personal device. There are also other issues with hospital IT security. Are those devices accessing my network? Are they accessing other kinds of secure information that I need? Other questions that IT has. Will consumer device always be working? What happens if the battery dies on something like an iPhone where the battery can't be replaced or charged quickly? What about cleaning and infection control? So as I mentioned, this data comes from a company called Spyglass Consulting. I'm going to give you some data or some information on how you can order that report if you'd like to get some more detail on this study that was done. Here's another important piece of information that came from that same Spyglass study. What are nurses actually doing with these smartphones? So we know that they're using their personal smartphones. We know that they're doing it unofficially without support from IT. Well, why are they doing this? What are they doing? Number one thing you can see here is a medical reference. There are many, many good medical reference tools available. Nurses know that they're there and they're using them. It makes sense. They want to be able to access all kinds of good medical reference information when they're on the move. Second thing that they're doing is cellular communication. It's just making phone calls. Many nurses don't have access to a work-issued phone device. If some of them only have pagers, some of them only have fixed phones. So they're using their own personal cell phones to make phone calls. The third thing here is text messaging. And we're seeing this happen more and more often in clinical settings that nurses want to send a text message. In many ways, sending a text message makes more sense than making a phone call. Often we've heard that physicians are more likely to respond to a text message than to a phone call. Often going from nurse to nurse, it's easier to send a text message from one nurse to another than to make a phone call. If a nurse is busy, they can't always answer the phone, but a text message gives them time to reply at a later date when they're not so busy. And then finally, web surfing. Being able to look up information in hospital systems, databases, etc. So you can see from this data that nurses have some real good uses for using their personal smartphones at the point of care. Well, what does IT think about this? Do hospital policies allow nurses to use their personal smartphones? This same study, when Spyglass Consulting asked these hospitals around the country, it was a resounding no. Very, very few hospitals officially allow nurses to use their personal smartphones. It's not just no, it's heck no. It's a no, no, no. It's very loud. So almost 90% of hospitals across the country are telling nurses they can't use their personal smartphones, yet they are. It's happening a lot. So this explains a lot of the tug of war. Nurses have a legitimate need to have a smartphone at the bedside in a clinical environment, yet IT is clearly saying no, that's the tug of war. Well, why the IT resistance? Why so much IT resistance? The question was asked, is a smartphone the right device to support clinical communications? And you can see there's major doubt among hospital IT. The vast majority of them, again, almost 90%, say no or maybe. There are really strong concerns that IT has about using consumer smartphones in a clinical environment. Why are they so clearly against it? One major reason is consumer devices are not appropriate to be used in a clinical workplace. This is a work environment. It's a very different environment, has very different needs than someone using their personal smartphone. What are the concerns that IT has? Durability. What happens if the phone breaks? Security. The issues of being able to control what devices are on their network and that access their data. How do you manage someone's consumer device? How do you clean it? There are just a long list of concerns that IT has. And IT is also, they're really limited by budgets and resources. They don't have the time to go through and address all these issues and find a way to take a Samsung or an Apple consumer smartphone and make it suitable for the work environment. It's just not something that they're set up to do. So this really helps to understand this tug-of-war situation that we're in today. Hospital IT has major concerns about the use of consumer smartphones in a clinical environment, yet we know nurses are doing it anyway because they have a real legitimate need, real good reasons to have a device like this when they do their job. But this tug-of-war isn't a stable situation, and it's not something that really can go on very much longer. So is there a solution? Yes, indeed, there is a solution. And the feedback was that there needs to be something new. There needs to be something that's an enterprise-class smartphone, something that is a hardware platform that's durable and cleanable and usable. Sustainable means it can be used for a number of years. I'll talk about this later, but one of the issues that IT has with consumer smartphones is they tend to become obsolete very quickly. A typical life cycle for a consumer smartphone is 18 months, and then they go obsolete, they're replaced by something else. So what we've heard from enterprise class users, from hospital IT, is an enterprise class smartphone should be something that could be sustained, could be used in the organization over a period of years. Hospital IT is also looking for a type of device that can integrate with their Wi-Fi network. Almost all hospitals today have a very good, reliable, very robust Wi-Fi network. It's something that's been designed well, it's secure, it's pervasive, and that's the right way to introduce a mobile device into the hospital's network. Good management tools are also really important. So a smartphone, really to be used in a hospital in an enterprise environment, needs to have good management tools and good security tools. And then finally, looking at things from the nurse's point of view, enterprise class smartphone, hospital IT does want the nurses to have access to all of these good applications that they're already using. They want them to be able to make phone calls, but from an enterprise point of view, hospital IT really wants them to do VoIP communication that's integrated with their existing PBX. They want the nurses to do text messaging, but it needs to be HIPAA compliant. They want nurses to have access to things like employee directories. They want nurses to have access to alarms and alerts, but it needs to be done in a way that's FDA approved. And then finally, there are more and more applications in hospitals that require a scanner. So it would be really good to have the nurses have a device that can also do scanning. So this is the ideal enterprise class solution, the ideal type of mobile device for a hospital that would keep both sides happy, that would find a way to reduce or eliminate this tug of war. This is a kind of device that has all of the enterprise class features that makes hospital IT happy, but also has all of the things that allows nurses to become more productive. So this leads us up to Pivot. Pivot by Spectralink is a new product that we introduced just a few weeks ago. At the latest HIM show, just 2 weeks ago, we showed this product publicly for the first time. It is now shipping in volume. The name of it is Pivot, and I'm going to talk about this in some more detail and show how it helps to bridge this gap between a consumer smartphone and an enterprise class IT device that hospital IT will be happy with. So Pivot is a new device by Spectralink built from the ground up. It is not a consumer device put into a ruggedized case. It's a purpose-built device, but it has many of the features of a familiar consumer smartphone. It's something completely new. So we call this a WorkSmart device, and we deliberately don't call this a smartphone. It has some features of a smartphone, but what we really tried to do at Spectralink was create an entirely new product category. And what we tried to do was bridge this gap between what IT would like to see and what nurses would like to see. So let's talk about the left side here. So the things that we know nurses like about consumer smartphones, why they're using them so much in the workplace: ease of use, cool design, it's an interface they understand, there's a huge applications ecosystem, and it's simple to use, simple to navigate. On the right-hand side, all of the things that IT has told us that are important. Something that's purpose-built, that's a real enterprise device. It's durable, it's secure, it has enterprise-grade voice, it's interoperable, it's manageable, etc. So a good summary is this quote at the top. What's a WorkSmart device? It's a mobile phone with familiar features and usability combined with the quality, durability, and reliability essential for work. It's really a completely new kind of device. So what is Pivot? It's not a consumer smartphone, but it has many features, many of the familiar features of a consumer smartphone. It's not a traditional purpose-built Wi-Fi handset from Spectralink, although it still has many of those characteristics. Pivot is in a category by itself, and it's why we call it a WorkSmart device. So at this point, I'm going to go through more of the details of Pivot, and you can see this, this picture on the right is really meant to underscore this duality. On the right-hand side, you can see the split picture. It's meant to show how similar it is to a consumer smartphone. On the left-hand side, it's meant to show how similar it is to one of our existing Spectralink purpose-built Wi-Fi devices. So it's really the best of both worlds, and that's what that diagram, that's what that picture is meant to show. So let me start with the first group of things, and this is one thing that nurses really like, and we know that's very important to them. It's familiar. It looks and feels like a smartphone. It's simple to view, navigate, hold, and carry. It has a very large touch screen. It has an interface that's instantly familiar to anybody that's used a smartphone before. And it also has enterprise call features. So even though it looks like a consumer smartphone, it can be easily integrated into a hospital's enterprise call system. The second set of things, and again from the nurse's point of view, it's a mobile application platform, and we know this is one of the major reasons nurses are using their personal smartphones at work, is because they have access to a very large ecosystem of applications. So Pivot, just like a consumer smartphone, integrates with a complete set of Android applications. Pivot is an Android device, and almost any existing Android application will work on Pivot. It also has a full web browser, so access to web applications and resources. And also, just like a consumer smartphone, it can be customized to personal preferences and needs. A nurse can have on there exactly what applications that he or she wants. It can be customized with wallpaper. It can be, you can change the location of where each of the icons are. It can have its own phone book, things like that. It can be customized just like a personal consumer smartphone. Now, looking at things from the point of view of IT, from the hospital IT, this is a purpose-built device. It is not a consumer device. So it is durable. Unlike many consumer smartphones, which can be broken fairly easily, this is purpose-built to be very durable. It is meant to be used in harsh environments. It's meant to be shared across shifts. It's meant to be used 24/7 for long, long periods of time. Longevity and support, I mentioned this before, this will not have the life cycle of a consumer product. This is something that Spectralink will sell and support for years. It also has other enterprise-grade features like an industrial-grade barcode scanner. We don't use a camera to read barcodes. It is a purpose-built barcode scanner. It has other features such as an accelerometer so that we can sense things like the position of the phone. Some other things from the IT point of view. It's very dependable. Excellent voice quality is a heritage of Spectralink. It's something that we're very proud of. Has excellent voice quality on a mobile device. I'm going to talk about this in more detail later. But we have some features that we call secret sauce so that we can really make this suitable for use in any in-building environment. Professional warranty support. We have industry-leading warranty and support policies. And then finally, manageability and security. These are some of the biggest concerns that hospital IT has, and we've put a lot of effort into the design of this device to make sure that it has enterprise-level security and privacy, that it can be managed through mobile device management tools, has many important features beyond a consumer smartphone. So finally, this is a picture of what the device looks like. This is what Pivot looks like. I'm going to have pictures later to show you what it looks like, but you can see the actual device. It really, to a user, looks like a consumer smartphone. Behind the scenes, of course, there are many of these things I talked about that address the concerns and needs of enterprise IT. But from a familiarity point of view, this has the look and feel of a consumer smartphone. Okay, let me talk about now some of the applications in more detail. And I'm going to walk through these one by one fairly quickly, but I want to give you a better idea of what each of these are. Let me start with enterprise voice. And this is always one of the most important things that nurses want to do, is simply to make a phone call to a colleague, to a physician, to lab, whatever they want to do. Very important for nurse productivity, and this is something that Spectralink has historically been very strong at. This is a Wi-Fi device. We are using Wi-Fi to do enterprise voice. This is not a cellular device. So the advantage of this is we're not dependent on the cellular network for things like coverage. We know that most hospitals complain of often poor or at least spotty cellular coverage inside. That's a real issue if a nurse or another healthcare provider always needs to be in touch when they're on the job. By using the Wi-Fi network and working with hospital IT, we can be sure that the nurse is always in touch, that she always has coverage, no matter where she is in the building. And we do that by having our enterprise voice use the Wi-Fi network, not the cellular network. Another advantage of using Wi-Fi is there's no recurring cellular charge. And this can become quite expensive in some of the larger facilities that we've seen where there could be a large number of nurses, and at some point it's just not cost effective to have a cellular plan for each phone or for each nurse. So by using Wi-Fi, we can eliminate those recurring cellular charges. Text messaging. We talked about this as well as something that most nurses are doing today, unfortunately, on their personal consumer smartphones. The Pivot device is a very good text messaging device. There are many good third-party HIPAA-compliant text messaging applications out there. And we know this is a major requirement for every hospital, is whatever text messaging solution that's used must be HIPAA compliant. As I mentioned, there are many out there, third-party text messaging applications, and they will run very well on Pivot. Pivot is a very good platform for these HIPAA-compliant secure text messaging applications. Nurse call integration is something also very important for nurses. When that patient there has an issue, they have a nurse call button or some other way of sending a notification. Nurses would really like to get those notifications on the device that they're carrying around with them. They would really like to get who it was, what their issue is. Maybe they can make a phone call back quickly and resolve it. Maybe they don't physically have to go there. But integration with nurse call is something that also comes up frequently when we talk to nurses and their management teams about how we can help make nurses more efficient. And again, Pivot integrates very well with all of the leading nurse call systems. Patient monitoring, alarms and alerts. This is something getting a lot of attention with the Joint Commission 2014 National Patient Safety Goals. Very important that nurses have the right alerts, the right alarms, and know the right steps to take. We've gotten a lot of interest in people wanting to find a way to send these alarms and alerts, to filter them, to prioritize them on a single device that the nurse carries around with them. And again, Pivot is a great device for running these third-party alerting and alarming applications. Barcode scanner integration. I mentioned earlier in the presentation that Pivot also supports an optional barcode scanner. There are more and more types of workflows and applications in hospitals now depending on barcodes, 2D, 3D barcodes. Most patient wristbands now have barcodes, most medication has barcodes, and it's becoming something that is really woven in tightly into the nurse's daily workflow. So having the ability to have the barcode scanner integrated on a single device means the nurse doesn't need to find a separate barcode reader. This can all be integrated on a single device. Now let's talk about medical reference applications. If you remember from that survey that Spyglass had done about what nurses are actually doing with their personal smartphones at work, the number one thing they're doing is using third-party medical reference applications. As I mentioned before, Pivot is a standard Android device, and it will run almost all off-the-shelf Android applications. I've given you some examples here. I just found 12 or 16 of existing Android medical reference applications. Some of these are used extensively by nurses today. WebMD, Hippocrates are two, but there are literally hundreds of these that are available, and it's growing every day. Some of these are free, some of them are chargeable, but we know that nurses are using many, many of these. So again, Pivot is an excellent device to run these kinds of third-party medical reference applications. Now, what's different than a consumer smartphone is the hospital IT staff can completely control which of these applications that nurses have access to. And I know that's a concern that many hospital IT people have had. So one of the concerns is how do you control this? How do you make sure there aren't too many? How do you make sure the right ones are there? You could, as a hospital IT administrator, say nurses have access to, let's say, WebMD, Nursing Central, Hippocrates, but a nurse cannot access Facebook or ESPN. So that choice of which applications is completely under the control of the IT. So this can be done on an individual nurse level, or it could be done on a hospital-wide level, or even down to a department level. It's completely under the control of IT. That was a major, major piece of feedback we heard from hospital IT. So which applications are important to your nurses? Ask them, because we know they're using them today. Unfortunately, they're using them on their personal devices at work, but many of these applications are being heavily used by nurses today. The last thing I'm going to talk about here is just general web browser and internet. We know many hospitals have their own databases, their own resources internally that can be accessed via web browser. Pivot is also an excellent tool for this kind of general web browsing and internet access. Okay, let me talk about some of these really important IT features. So you saw how this really looks and feels like a consumer device to the nurse. They can do just about anything they would do on their personal smartphone. But what are some of the other things that make this different than a consumer smartphone? What are some of the things that really make this an enterprise device? One of it is manageability management. We call it CMS, Spectralink's Configuration Management Server. This is software supplied by Spectralink. It runs on your server, your IT server, and it's really meant to do centralized management and provisioning. Just about everything can be done completely over the air, and it puts you in control of exactly what's going on in these devices. You have complete control over what they do. You can configure them down to individual features. We talked a lot about before which applications nurses can use, but even more importantly than that, you can configure particular features. If you want to upgrade the firmware, you can do that all remotely. You can configure individual parameters, either on a particular handset, a group of handsets, or even enterprise-wide. It's really a very important tool for IT. Some other benefits for IT. I talked about management before. Event logging, hardware diagnostics, a very thorough set of diagnostics, very thorough set of enterprise logs. So if for some reason you need to find out what's going on, if there's an issue, there are tools that you can use to do that. Security is something also extremely important for hospital IT. There's an alphabet soup here of really important enterprise priority or enterprise level security. WPA2 is absolutely essential. Other things like 802.1x, authentication, fast handoff, SRTP. There's a long list of enterprise level security features. This is an enterprise device. This is meant to be something that you can control fully. Ease of integration is also something very important to IT. This is a SIP device, but will also run third-party soft clients to enterprise for enterprise telephony. It is an 802.11 Wi-Fi device, and it runs A, B, G, and N. It is an Android device. It runs Android 4.1.2. It does integrate with LDAP. There is an API to the XML interface for the web browser. I mentioned about future-proofing. Again, a very big difference from a consumer smartphone. This is something, our life cycles are measured in multiple years. Typically, enterprises tell us that when they put a device into use, they want to be able to use it for at least 5 years. Definitely, we fit that model. So a few other things. There are two models of Pivot. One with the optional barcode reader and one without it. It is not something that's field upgradable. It's a decision that's made up front at purchase. The form factor of the two is exactly the same, and I'm going to show you a slide later with more detail about the form factor. It comes in two colors today. We call it Healthcare Blue and Midnight Black. Later on, we'll have another version in white. This gives you a much better idea of what the phone actually looks like physically. There is a very important feature that we put onto the back of the phone, which would allow people a way of gripping the phone. One of the issues that we had to struggle with was phones are getting bigger, screens are getting bigger. This has a 4.3-inch screen, yet most nurses are women, and women tend to have smaller hands. We needed to come up with a way to make this navigable, usable with one hand of someone who doesn't have a very big hand, but has a fairly large pane of glass to navigate. So you can see here there's a ridge at the back which helps, and you can see in the upper left, even with a relatively small hand, almost all of that glass surface can be accessed with the thumb. It can also easily be used horizontally as well as vertically. Some other things. The touch screen can be used with gloves. We know that that's a situation that happens a lot in clinical settings. Cleaning, another very big issue. In most of the healthcare organizations that we talk to, they have some very strict standards on infection control and some very strong disinfectants and sanitizers that have to be used. We have designed this device with plastics that are highly resistant to the most common hospital sanitizers and disinfectants. And then finally, the last point on this slide is that it has a built-in kickstand, which means if you need to put the phone down for some reason, you can put it down upright, either vertically or horizontally. Other accessories, again, this is one of the things that differentiates this from a consumer phone. The batteries can be changed very easily. They're meant to be changed in a matter of seconds. There are no panels that need to be removed. There are no screws. There are no technicians who are needed. You simply pop the battery out and put a new one in. It can be charged with a micro USB charger, or what's more typical in a healthcare environment is through multi-chargers. Generally, a nursing station or some other central location would have a group of batteries here charging on standby. If for some reason a nurse needs a new battery, they simply plop in a new one. You can see a variety of carrying options. There are clips and cases and straps. We've tried to make this as easy as possible for nurses to carry as they do their job. Some more user benefits. I won't go through this in detail, but ease of use. As I mentioned, it's a 4.3-inch screen, very easy to see and to navigate, very easy to carry, customizable, things like wallpaper, ringtones, phone books, etc. Durability, meant to be used in shift environments. It's meant to be shared across multiple people. It's really meant to have a duty cycle of 24/7. Consumer smartphones are not designed for that. Clear communications, the voice quality is excellent. Workflow support, we talked a lot about those key applications that nurses are using. Emergency support, there's a panic button on the top. I won't go through all of the things here, but you get an idea of really how useful this can be to nurses. So the last few slides to summarize here. Are smartphones smart for healthcare? That's the question that I started the presentation with. Consumer smartphones, no. Consumer smartphones are not the right choice. Are consumer smartphones smart for healthcare? No. And there are a variety of reasons. We know why consumer smartphones are attractive to nurses. They really can help them be more productive, more efficient. But IT has some very, very big concerns with consumer smartphones. But there's a new class of device, and I described that with Pivot. There's a new class of device that really can keep both sides happy, that can keep the hospital IT staff happy and keep the nursing staff happy because it's something different than a consumer smartphone. It combines the best of both worlds. So it takes the best features of consumer smartphones, that familiarity, that usability, the application access, with all of the things that IT demands in a device that they're going to deploy and manage. Something that's purpose-built and durable, and it's enterprise class, and it's secure. So yes, there is something that can keep both sides happy, and that's Pivot by Spectralink. Just a couple more slides to wrap up, and then we'll turn things to questions. So early on, I mentioned the Spyglass report, where some of this data came from. I would recommend, if anybody would like to read it, it's highly recommended. There's much, much more detail in there, very good data about what nurses are really doing at the point of care for communications. The official title is Healthcare Without Bounds, Point of Care Communications for Nursing. The contact information for Greg at Spyglass Consulting is down here. You'll get a PDF version of this, and you'll get this in the follow-up, this information. But it really is a very good report to give you insight into what nurses are actually doing, and also the concerns that IT has. And then finally, where you can go to get more information on Pivot, spectralink.com/pivot. Lots more information, some videos, data sheets, all kinds of really good information about Pivot. So thank you very much. That's the end of my presentation, and I will turn it back to Eric.
Okay, thank you, Mike. We have about 15 minutes left, and we've had a number of questions come in through the presentation. So why don't I just get right into them? And as I said, they've been coming in through the presentation, so I apologize if some of them might have already been answered. Could you discuss a little bit more about the battery life and how easy it is to switch batteries during a 24/7 shift?
Yeah, the battery life is what we call use time. Formerly, we used to call it talk time because people were mainly using this for voice communication. Now we call it use time. And we expect use time to be a full 8-hour shift without having to change battery. And that would be someone using it fully for that entire 8 hours. Generally, even though this is something that people would carry around for shift, they're probably not using it for the full 8 hours. But yeah, that's what we spec it for, is 8 hours of use time. How quickly can it be the battery changed? I'm going to exaggerate a bit, but I think 10 seconds would be a long time to change the battery. It really is as quickly as just taking a little latch, popping the battery out, and then putting a battery back in. Is very quick.
Okay, another question. Can monitoring waveforms be sent to Pivot?
Yes, definitely.
Okay. Which middleware companies do you partner with?
There are a variety of middleware partners we're working with. I don't want to leave anybody out, but Connexall, Extension, Amcom, those are the ones in the U.S. I know I've left somebody out.
Okay, we've got another question about the batteries. Will battery changes cause the user to log in again?
The phone will be rebooted when the battery is changed.
Okay. Are phone calls to and from the outside world supported?
Yes, definitely. You can call either a full 10-digit number to call somebody on the outside, or you could use the hospital's internal 4-digit extension system, whatever they have assigned. It's just another extension on the hospital's PBX.
I guess this is a similar question to what you just answered. Can 10-digit phone numbers or hospital extension phone numbers be assigned?
Yes, definitely a hospital 4-digit extension will be assigned to the phone when it's provisioned.
Okay. How does the roaming or voice ability compare to Wi-Fi roaming of an iPhone?
Very good question. iPhones are meant to do a couple of things really well. One is it uses the cellular system for voice, and it uses Wi-Fi for data, and it does both of those very well. What the iPhone doesn't do very well is the combination of the two, of using Wi-Fi for voice. And that's really something that's very different. Using Wi-Fi for voice is very different than just having an application use Wi-Fi. And some of that is because you're hearing something. The user is very, very sensitive to voice conversation, to what they're hearing in their ear. So even a relatively minor pop or crackle or a drop or a gap is a big issue for a user, especially in a healthcare environment where important information could be being communicated. So we have a much better way of doing voice over Wi-Fi than an iPhone or other consumer smartphones.
How are these devices being sold? Directly through Spectralink or through a reseller?
We sell through resellers.
Do they come with, or do they need a belt holster or a neck lanyard?
All of those are available as options.
Okay. There are a couple questions here on durability. How durable is the pivot? Can it sustain being dropped? And also, is it bulky, or can it fit into the leg pocket, the scrubs, and is it heavy?
Yeah, a couple of things. Let me take those one at a time. So durability. This is meant to be dropped. We certainly don't encourage it to be dropped, but we've been selling to nurses for probably 20 years, and we know what happens in a typical nurse shift. These products get dropped and bumped and kicked and hit, and it's just the nature of the beast. So they are designed to be to withstand those kinds of environments. In particular, there are two industry standards that we meet. One is called Mil Standard 810G, and this is about dropping, and it's a test, and we go through this test, and we drop the phone over and over and over again onto a concrete surface. That's what the Mil Standard test is, and we meet and exceed that. And then the other one is about ingress protection, and we have an IP64 rating, which means that it's protected against dust and also protected against spraying water. So that was the question about durability. Then the question is about weight and size. You'll find that the weight of this is about 200 grams, including the battery, and that's about the average weight of a consumer smartphone with a case on it. Almost all users that we see who are using a consumer smartphone, especially at work, have some kind of case, in many cases something meant to add durability to it. The device, or the weight of this device, a pivot, is meant to be equal to that, about 200 grams.
Okay, here's a good question. Does it store patient information, and are there any HIPAA or personal health information concerns?
No, that's a very good question. A lot of that is going to be dependent on the applications that are used. So one of the examples I gave was about a text messaging application. There are many good third-party text messaging applications. That's not something that we provide. And those, I'd encourage you to find those that are HIPAA compliant. Most of them are, and then those address it that way.
Okay, here's a rather specific question. Can the phone have an extension off an Avaya phone system?
Yes, definitely. Avaya, Nortel, Cisco, many others, Microsoft Link. Yes, it is meant to be an enterprise extension.
And I know you've discussed this a little bit before. If a nurse is going into a dirty room, is there a cover that can go over the device, or is a cover needed?
There is a cover. I wouldn't say a cover is needed. It is meant to be cleaned. I talked about that before with some, the common cleaning chemicals that are now used in most hospitals.
Okay. Does the pivot keep a log of missed calls?
Yes.
Yeah, we're getting right down to the last couple questions here. Will you be able to pull up individual user profiles for shared users across shifts?
Yes, if I understand the question correctly, it is a feature that will be available in the future. It's not available now.
Can it have a list of contacts?
Yes, definitely.
Okay, is the Pivot SIP compatible?
Yes. Yes, it is a SIP device.
Okay. They're coming in fast and furious here. How many contacts can it hold?
A large number. That's a very good question. I would say hundreds. I can get back with an exact one, but it could even go up into thousands. It is meant to be LDAP compatible, and there are some directories that can be very, very large.
Okay. Can each user have their own logon and profile?
Yes, eventually. We will have that capability, not on the first release.
Okay. How durable is the battery clip for repeated use of taking off and putting back on?
It's meant to be extremely durable. It's meant to be changed multiple times a day, so we've designed it to be as durable as we possibly can.
Okay, I've got one last question here. Can each user have their own list of contacts in the phone?
Yes.
Okay, that pretty much answers all the questions we've got. Before we wrap up, I'd like to ask the audience to take part in the exit survey that will be popping up on your screen. Thank you, Mike, and thank you, everyone, for joining us today. If you would like to view the archive of this webinar or share it with a colleague, please visit the on-demand webinar section on mhealthnews.com or healthcareitnews.com. Thanks again, and have a nice day.